everyone. This is Dr. Aishwarya Matikati. I'm a consultant infertility specialist in Tamra Hospital and IVF Center, Rajajinagar. So today I'll be discussing with you a few topics regarding concerning the infertility. So the couples who are planning to conceive and trying for the parenthood and who are already planned and still not able to conceive. So I will take you to the journey of how is the process of conceiving. So initially the main topic which I want to discuss is the present day, why the couples are unable to conceive even at the young age also. So that is one of the discussion of the topic is the lifestyle factors. So the lifestyle factors which are affecting for both men and the women. So coming to the women category, the first thing what we see is nowadays is the obesity. So obesity is one of the features which we are seeing in common, where the BMI is increased more than 25 to 26 and the woman is not able to ovulate and she is having difficulty to conceive. So obesity, once she falls into category, then we need to rule out what are the features, what are the factors which are able to reasoning for this kind of obesity. So the first thing in obesity we see is the polycystic ovarian syndrome, which is again a very common issue which has happened nowadays even in the youngsters also. So it may start in early in the menarche, that is around 13 or 14 years. In case if at all there is not a proper guided nutrition or lifestyle factors like exercise, all these things are making the child or the girl who enters the menarche into a obesity factor, and that is leading to the polycystic ovarian syndrome. So once we say polycystic ovarian syndrome, usually what we see is there will be anovulation, that is the ovulation doesn't happen regularly and the cycles will not be regular, that is the lady will be having or the girl will be having once in 3 months or once in 2 months, or it will be not a 28-day cycle. So she is going to skip the cycles. Sometimes if the obesity or the polycystic ovaries is in a very worst stage, there are scenarios where we see the women getting her periods once in 6 months or once in a year. That is called a severe polycystic ovarian syndrome. So now in this scenario, when up till 16 years, we tell that if there is a variation in the periods, we tell them to just modify their lifestyle factors, that is by correction with their nutrition and by correction with their doing the regular exercise, doing some yoga. That is going to help in bit of reduction of weight, will definitely certainly help the women in correcting her cycle and getting her regular cycles. So in case if the women comes to us, like if it is not corrected by 18 years and they continue with the irregular cycles, so we tend them to come and talk to us so that to see where she stands. That is, early detection of polycystic ovaries will definitely benefit in conceiving in the later stages. So that's the reason we tell nowadays, in the young age around 15 years, if they start having difficulty or having difficulty in the periods, we tell them to see for a year to see how it is going about after correction of all these lifestyle factors. Followed with that, if there is no correction, then they have to come down to the gynecologist so that we can plan out and we can see where exactly in which stage is the polycystic ovarian syndrome is. If it is a severe polycystic syndrome, then that is we see through the scanning, then we see through the blood test, that is hormonal test we see with the testosterone level and serum insulin level and the androgen level to see where exactly the stage she is in, and we see in the scanning guided, that is ultrasound, we see the ovarian size, we see the volume and we see the how many follicles, that is AFC, we see that. So if it is more than 15 or 20 follicles, then she is in a severe category of polycystic ovarian syndrome. So in these type of features, if the lady crosses the age of 18 and still her periods are irregular, it's better you consult the gynecologist, and once all this done, then we start giving her hormonal replacement therapy so that to help to reduce the hormonal level so that the PCOD, the polycystic ovarian syndrome which is characterized, which is there, that is going to come down, and that will help in regular periods along with her lifestyle modification, which has to be simultaneous along with the hormonal correction. So once this correction has been done, if this goes, definitely the polycystic ovaries will come down and the easier way to conceive. And if at all it is not done properly in the initial stages, that is in the early stage of around 15 to 18 or 18 to 20, that is where nowadays we are seeing a lot of women generation, that is between 21 to 22 to 30 years, they're coming with the highest numbers of polycystic ovarian syndrome, because since it was not guided initial back in 10 years back when they were going through it, so now they are coming back to us with this kind of scenarios where they are not able to get their periods regularly, and obesity, and due to this the anovulation is more. When the lady comes down with the polycystic ovarian syndrome, this is, I'm talking between the age of 21 to 30 years. So first we do the same thing, that is we go through the certain number of scannings to see where exactly she is in, I mean what size of the ovary, then the follicle size and the volume, and then we will see her hormonal levels. Once the hormonal levels everything is corrected, initially we go through the harmonic tablets, which is if at all she falls in a severe polycystic ovarian syndrome. So once the hormonal correction is done and there are changes in the polycystic ovaries, and if the couples are trying, that is if the woman is trying for the pregnancy, then we can try naturally. See, there are many victims thinking that polycystic ovary thinks if at all the woman is having a polycystic ovarian syndrome, they cannot conceive naturally. But since there are treatment, there are things which can make the correction happen. So what we tend to do it over here is, first we see which stage she is in. If she is in mild to moderate stage of polycystic ovaries, then we try giving her, so that make her ovulation regularly, and followed with that we give for a natural conceiving treatment only. For we'll see for 6 to 8 months, and there are chances of highest chances, because we are seeing in a ratio over here, that is out of 10 women if we see the polycystic ovarian syndrome, we make it a point at least 3 or 4 conceive naturally, and the remaining set of categories will be having other scenarios attached with polycystic ovarian syndrome, so they will wander into other category of treatment of conceiving. So once the natural treatment of conceive has happened, then we follow them regularly so that the pregnancy goes smoothly. And then they follow the second category is where there is a resistant polycystic ovary syndrome, that is even with the hormonal treatment and even with the hormonal correction and even with the regular thing, if they are not able to conceive, then they go into follow into an other category of treatment, that is we go for laparoscopic ovarian puncturing. So in laparoscopic ovarian puncturing, what we do is we see where she stands, that is we go through is what do the test we do is the anti-Mullerian hormone. So in this AMH we determine where exactly the woman is falling in the category, so because this will tell the reserve and the quality of the eggs. So if the AMH, the normal AMH between 20 to 30 years is 2.5 to 6. So suppose when we do an AMH and the AMH showing us is more than 12 or 13 or 14, that is anything about 12, that means she is falling in the category of resistant polycystic ovarian syndrome. That is the androgen levels will be very high. So even with the tablets it doesn't work, that is tablets which I am talking about is the hormone replacement therapy, if it doesn't work. So what we do is she has to go through the procedure of laparoscopic ovarian puncturing, that is it's a daycare procedure. So through the laparoscopy we see the polycystic ovaries, we just puncture those through the laparoscopic needle, and once the puncturing is done, then the woman is discharged on the same day. So the benefit of this is there will be a shrinkage of the ovary, that is there is a reduction in the ovarian size, the volume also will come down, and the chances of fertilization and the ovulation happens is very fast. So we usually say that post laparoscopy within 6 months is the conceiving rate is faster. And yes, we have seen so many patients conceiving that, like so suppose like 10 people undergo laparoscopic surgeries, in a 6 months or 7 months span when they try for a natural cycle, around 4 or 5 patients conceive naturally. So once the women undergo with the laparoscopic and once she follows with this regular treatment and regular same along with the lifestyle modification, yes, the chances of conceiving increases. And then there are the last category which I am going to talk about, that is in polycystic ovarian. After with the hormone treatment, after with the laparoscopic, still the patient is not able to conceive, where they fall in a very high androgen levels contained, that is the ovaries are so thick that there is a thickened albuginia. So what happens, the ovulation, the egg quality deteriorates. So for such kind of resistant cases, the last therapy we manage is artificial reproduction. That is, either we give an option with an IUI, that is intrauterine insemination, or we give them an option of IVF cycle, where the patient has been stimulated with the injections, with the hormone injections, and then we do the egg pickup, and then we do an ICSI procedure followed with the embryo transfer. So this is for the resistant cases. So as I mentioned in the early, so in the PCOD category, if at all the patient comes to us for a PCOD, so these are the initial ways we start with the PCOD patient. So out of 10 people in the PCOD, I think so 3 or 4 patients will land up with the IVF. It's not that all patients with polycystic ovarian syndrome will land up into IVF. There are managements which can be done so that they conceive naturally.